Hello, my name is Natalia Kelly and I will be presenting to you a general overview of cerebral vision impairment, also known as CVI. This condition is the leading cause of vision loss in children living in the developed world, so it's important for you to have a general understanding. The presentation will cover what is cerebral vision impairment and associated terminologies, the differential diagnoses and outline of various etiologies associated with this condition. I'll also be talking to you about coexisting neurological and ophthalmological conditions and also the incidence and prognosis of CVI. So in contrast to ocular vision impairment, which is vision loss due to an ocular pathology, CVI is a form of vision impairment that relates to disturbances in visual perception and integration with or without visual function loss, such as reduced acuity or visual field. Cerebral vision impairment is a term which refers to temporary or permanent bilateral loss of vision. This is based on whether or not the vision loss is in the absence of impairment due to the anterior visual pathway, or vision loss greatly exceeds that which would be expected by any major ocular disease. The abbreviation CVI is used interchangeably between cortical and cerebral vision impairment around the world and also in literature. Cerebral vision impairment is commonly used in some countries such as England, while cortical vision impairment is popular in other countries such as America. This causes a considerable amount of confusion. The two different descriptors evolved because the field of neurological vision disorders in children was new, and also because of inadequate communication between various research groups. There is now a common understanding that cortical vision impairment refers to lesions along the retrogeniculate visual pathway, including the LGN radiations, occipital cortex and subcortical areas of the brain, whereas cerebral visual impairment is commonly referred to individuals who exhibit visual processing disorders. That is, they have difficulty interpreting and integrating vision into a meaningful sense. For the purpose of this presentation, I will refer to CVI as cerebral vision impairment. There is quite a lot of caution that is exhibited by ophthalmologists when diagnosing CVI. This is particularly due to the diversity of the characteristics that could be displayed by an infant or child with CVI. The diagnosis is commonly delayed as it can be confused with other conditions such as delayed visual maturation or autism spectrum disorder, to name a couple. Delayed visual maturation is a condition where the children display visual attention or delay in their early years of life. Vision development commonly reaches its normal range at around 6 months of age, while autism spectrum disorder is a condition which affects an individual's ability to relate to his or her environment and their interactions with other people. CVI commonly involves incidents relating to impairment of natural development of the brain in utero or early in life. This could be in the form of a hypoxic insult, where there is a lack of oxygen to the brain. Premature birth, where the brain is unable to fully develop. Exposure to toxicities in utero or infections such as hydrocephalus could also be causes of CVI. CVI can either be congenital or acquired. Acquired CVI could be a result of non-accidental head injury such as shaken baby syndrome or physical abuse. There are numerous neurological conditions associated with CVI. Most common comorbidities include cerebral palsy, which could involve hypotonia or hemiparesis. There is also epilepsy, hearing loss, and microcephaly, which is a significantly smaller head due to abnormal brain development, to also be considered. This list here only reflects a small portion of associated neurological conditions. The incidence of the conditions that are highlighted here are reflected in Hugh and colleagues' paper, Chronic Cortical Visual Impairment in Children. CVI can also coexist with other ocular conditions such as strabismus, uncorrected refractive errors, accommodative insufficiency, oculomotor apraxia, nystagmus, and other anterior visual pathway disorders such as optic atrophy, coloboma, ROP, and optic nerve hyperplasia, to name a few. Hugh and colleagues reported that in their study of 7,200 patients, about 18% had ophthalmological deficits, which were coexisting with CVI. In recent years, there has been a restructuring in the prevalence of pediatric ophthalmic conditions due to advances in treatment and also management of what was once common disorders. For example, retinopathy of primary or ROP used to hold a high rank in prevalence, but is no longer considered to be a dramatic threat to vision loss. CVI is relatively new in the ophthalmic profession. As noted earlier, many ophthalmologists are still hesitant to officially diagnose this condition. So statistics to identify prevalence may be masked by this hesitation, and prevalence is likely to be higher than what is officially recorded. The prognosis is quite guarded in this cohort because there is no uniform classification system available. Many have put forward classification criteria, however none has gained international consensus. This is partly due to the heterogeneous nature of CVI and the diverse characteristics of this condition. In regards to the prognosis of CVI, the literature is tending to lean towards there being an improvement in functional vision. However, this is on condition that intervention is offered to the individual. In my experience, which is around about 15 years or so, working with children with CVI, I have seen a gradual improvement of functional vision in those that received intervention from educators and allied health professionals. However, the prognosis is also very dependent on coexisting morbidities. Ill health due to a common cold or a significant epileptic seizure, or external factors such as changes in medication to address other comorbidities, can easily cause regression in their development and consequently their ability to use their vision. So it's important to understand that when providing services to an individual with CVI, you need to take into account various factors to understand the individual and how they will respond to intervention. I hope this presentation has given you some insight into the complexities of CVI. Thank you.